When you think of markets for health insurance, probably sub-Saharan Africa isn't at the top of your list, but it is the market that Emma Coles serves. She is the head of the Health Insurance Fund. It's a Dutch foundation founded in 2006 to supply low-cost health insurance in sub-Saharan Africa. And we caught up with her at the IESE conference in Barcelona, doing good, doing well. Emma, thanks for being with us on INSEAD Knowledge.
You're welcome.
How big is the market for your health insurance?
The market is huge. At the moment in Africa, only 10% of healthcare costs are covered by any kind of risk pooling health insurance mechanism. Africa bears 40% of the burden of communicable diseases and has 10% of the resources, the global health resources.
When I think of sub-Saharan Africa, I tend to think of HIV/AIDS. Is that still the problem that it used to be? Are there other issues?
It's still a large problem in many countries, but in our schemes in Nigeria, malaria is the #1 problem. And after that, we have upper respiratory diseases, diarrhea, and we also see hypertension. So cardiovascular disease problems are important in Nigeria.
Where does your funding come from?
We were granted in 2006 a commitment from the Dutch government for €100 million. And we have also signed a contract with the World Bank for a program in Lagos for $6 million. And we have recently signed an agreement with USAID where they will provide us up to $20 million to support specific areas of our program.
You must have partners. It's no good having health insurance if there's nowhere to use it.
Absolutely. The in-country work is done by local partners. The Health Insurance Fund was founded by Farm Access, an organisation that's been working in healthcare in Africa for the last 10 years. And the Health Insurance Fund was set up because the Dutch government was making this major commitment. We needed to have a governance structure to manage the commitment and the relationships with the partners. So we actually partner with Farm Access, who does a lot of work on the quality of healthcare, setting standards in healthcare. And they contract local insurance companies, private health insurance companies, that roll out the programs for the groups that we are providing healthcare to.
How do you find customers who can take this insurance? I guess I'm asking you, how do you market health insurance in sub-Saharan Africa?
It's a huge challenge, and it's interesting because health insurance is a very intangible product. You can't feel it, touch it, hold it, unless you happen to be sick. Now you've got to try and persuade people that healthcare is something that is interesting and useful. And although we know that many people fall into poverty from their healthcare costs, there's still a lot of education and understanding that's needed. And in Lagos, we're working with market communities, the leaders' market groups. In Kwara, we're working with a rural community where the traditional leadership plays a role. And in Tanzania, where we will launch shortly, we're going to work with a microfinance organisation and coffee cooperatives.
What does it cost?
The pricing, at the moment, it is $60 per year, the actual price, and in Kwara it's $30 per year, but we pay a subsidy. So the people buying the insurance pay between 8 and 15% of that cost. So it's a few dollars per person, and then they have to pay for their families, so then it's perhaps $25 for a family. Women's health is an extremely important issue, particularly in Nigeria, where maternal mortality rates are over 1,000 per 100,000 live births. And in many communities, it's difficult for women to get access to healthcare.
What are your next steps? How are you going to grow the business?
Well, our next important step is launching a program in Tanzania, and we will start with 2 groups there. And the other thing we are looking at is in Kwara State, we're working with the governor. Now, the governor has 2.4 million people in his state and has a vision to reach universal coverage for his state. So what we're discussing with him is whether we can play a role in expansion in that state. Assuming that the programs in Kwara continue to run successfully, we'd like to talk to him and other donors about how we could roll out further. But we're also trying to learn, so we're not immediately looking for massive expansion. We want to really understand what works, really understand the risks, really understand the costs, so that others can also use our models and take them further and expand.
Thank you very much, Emma Coles, for being with us on INSEAD Knowledge.
Thank you very much.